Today, the CDC is recommending a booster dose of Pfizer's COVID-19 vaccine for some people. Tonight, we'll hear more from local health officials about how people here on the High Plains could be affected. The CDC recommends Pfizer booster shots for these groups at least 6 months after their primary Pfizer series. People 65 and older and residents in long-term care settings should receive a booster. Those 50 to 65 with underlying medical conditions should also get a booster. People 18 to 49 with underlying medical conditions may get a booster shot based on their individual benefits and risk. And the CDC says people ages 18 to 64 who are at increased risk of COVID-19 exposure and transmission because of their occupational or institutional setting may get a booster.
For those who have immunocompromising conditions, whether that be medications they're taking or a disease state that affects their immune system, it appears very clear that third dose is also going to be critical to really give them the full response to the vaccine.
Dr. Rodney Young, the Regional Chair of Family and Community Medicine at the Texas Tech University Health Sciences Center, says J&J just published data showing a strong antibody response from a second shot, and the J&J and Moderna boosters could be coming soon.
If you got the Moderna vaccine, you are likely in not too long going to be told, okay, here's your opportunity for a booster dose. If you are fully vaccinated with any of the 3 available vaccines, your risks are low if you have a normal immune system. If you're older or have reasons to be immunosuppressed, you'd be a better candidate for a booster sooner.
Dr. Brian Weiss, the Chief Medical Officer at Northwest Texas Hospital, says they initially gave the Pfizer vaccine to patients and the majority of its staff.
We were anticipating that that there would be a recommendation. We purchased our third doses. We have them in stock. We were waiting for the official CDC guidelines. And so we are planning on starting our distribution of the booster vaccines to the appropriate population at the beginning of October.
The city of Amarillo says the Amarillo Public Health Department is currently meeting demand for Pfizer vaccines, but they can order more as needed. They're only providing the Pfizer COVID-19 vaccine to those between the ages of 12 and 17 at their various vaccination clinics.